I'd like to welcome you to our August 18th, 2021 special meeting of the Mecklenburg Board of County Commissioners, sitting as a consolidated human services agency. And in fact, I'll make a point to explain the difference a little later on in our meeting. But the purpose of this special meeting is to receive an update from our Public Health Director and recommendation to consider adopting a proposed countywide face covering requirement, receive public input on, and if approved, authorize the clerk to the board to publish the proposed rule to become effective not less than 10 days after publication is completed. Since this is a special meeting and due to the ongoing COVID-19 state and local state of emergency declarations, not all board members are able to participate in person and will participate remotely. Just so that the public is aware, the public may join and follow the meeting by viewing on the web on the government channel at https://watchmecnc.gov, or you may follow us on Twitter. Since some members will be participating remotely, there are a few housekeeping rules that have to govern our actions so that the board minutes are accurate and the actions are consistent with the law. We will have each of our remote participants identify him or herself so that the records can reflect who is present and participating in the meeting. Mr. Attorney, let me ask the question first before I proceed. Do I first need to get a motion on the floor to allow the remote participation? It is not required in this particular meeting.
Right.
Thank you. All right, so we will introduce all of our board members who are present in this meeting. Again, I am George Dunlap. I'm physically present at the Government Center. I represent the people of District 3, and I have the privilege of serving as chair of the board. Next, we'll turn to Commissioner Lee Altman.
Good afternoon. Commissioner Lee Altman, serving at large.
Commissioner Pat Cotham.
Hello, I'm Pat Cotham, County Commissioner at Large.
Commissioner Ella Scarborough. Okay, she's having some concerns with her internet. All right. We'll turn to District 1.
This is Commissioner Powell. I represent District 1, and I also serve as Vice Chair.
District 2.
My name is Vilma D. Leak, and I represent the most powerful district in this county, and that's District 2.
District 4. I think the commissioner from District 4 was dealing with health challenges with a family member and may not be present. Commissioner, District 5.
Good afternoon. I'm Laura Meyer, and I represent District 5.
And District 6.
Good afternoon. This is Commissioner Susan Rodriguez McDowell. I'm elected by the people of District 6, and I am participating remotely.
For the record, 8 of the 9 members have acknowledged their presence for the meeting. I will now ask the following persons to introduce themselves. Our clerk to the board.
Good afternoon. I'm Christine Smith, clerk to the board.
Our deputy clerk, we don't have one yet. Our county manager, there's a job opening. Our county manager.
Good afternoon, Dina DiOrio, County Manager.
Our county attorney.
Good afternoon, Tyrone Wade, County Attorney.
All right, would you all join me in standing pledge of allegiance? I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
What a personal privilege, Mr. Chairman, for clarity for me. Are those persons going to be able to participate that's asking to be excused from being present, except for Ella Scarborough and Pat Cotham?
My understanding, under the rules, since we're in a state of emergency, all members who are present virtually will have full participate in the meeting.
That's correct.
And that's in what information? That was not given to us before this meeting.
That's under the revised statute, Commissioner Lee.
I can't hear you.
When there's a remote meeting, the law allows for remote participants to participate in the meeting.
Well, we have voted before, so I'm not clear.
This is a special meeting.
He's not, well, the lawyer's not making it clear for me.
Because this is a special meeting and all members cannot attend, the law allows for remote participants to participate in the meeting.
And this is the only kind of meeting that we allow persons who cannot be here to participate.
Well, you allow it because it's a special meeting, but the board can adopt different rules if the board chooses to do so.
Well, you didn't give us that privilege at the beginning. We immediately said that these people would participate. And let me say this to the public. There have been times when other members of this board have been unable to participate, and there are 3 people who always vote against them participating when they can't be here. And I think it's unfair. And maybe I'm speaking out of order, I don't know, but I don't ever know what's going to happen to me that I can't be here. And all of a sudden they want us to allow them to participate when they have voted against members of this board to participate because they could not be here. Pat Cotham had surgery. And the other person, I'm not sure what the rationale is. And every time they come up with the names of those individuals, these 3 people always vote against them being able to operate from home or wherever they are. So that's why I'm speaking to the public to see where there is injustices for some people. And here we're talking about an ordinance about treating people fairly. We have to treat all of us fairly. And that's what I'm speaking for. And I want the public to know what we do here reflects the organization that we represent. And it's unfair for them to sit here and vote no and want us today to allow them to participate.
All right. Okay, moving on. There are some housekeeping rules that we must adhere to. This afternoon, the board will receive a presentation from our Public Health Director and a recommendation that the board, sitting as the Consolidated Services Board, consider adopting a countywide Board of Health rule requiring face coverings while indoors. In order that the records and the minutes are correct, it is still necessary that I recognize each commissioner and ask whether or not they have comments. I will again ask you to please wait until you are recognized by the chair before speaking and refrain from speaking over one another. May I also suggest that each speaker ends his or her comments by saying, "This concludes my comment." If a commissioner does not have any comments, please state, "I have no comments," or "I do not wish to speak to this matter." So at this time, I am going to turn the presentation over to Dina. But before doing so, I think it's important that people understand what a Consolidated Human Services Board is. We've discussed this for some time now. Some of the public understands that we're meeting as a Consolidated Board of Health as opposed to the County Commission. So, Dina, if either you or Tyrone would take a moment and explain that to the public.
County Attorney.
Well, good afternoon. So, under North Carolina law, a Board of Commissioners can assume the duties of the Board of Health and the Board of the Department of Social Services, and then they can operate as individual boards or as a collective board for those individual bodies. Mecklenburg County has done that, so we have a consolidated human services agency, and so when the board meets as a consolidated human services agency, they can deal with issues dealing with the Board of Health or Health Matters or DSS and DSS Matters. And today, the board is meeting not as the Board of Commissioners, but as a Board of Health to hear information from the Public Health Director.
Thank you for explaining that. I thought I could, but I think you probably did a better job. All right.
Mr. Dunlap, I have a question that injects the health committee that we have. That board has nothing to do with this.
Absolutely.
So that needs to be clarified by you to the general public, because several people called me and asked me about it.
Yeah, this is not a Board of Health subcommittee or ad hoc committee. The Mecklenburg County Board of Commissioners serves in both roles as commissioners and as the Board of Health. Today, we are meeting as the Board of Health. All right, County Manager.
Thank you, Mr. Chairman. I'm going to ask Public Health Director Gibby Harris to come to the podium so she could make her presentation. But as you indicated, we had a meeting of our policy group on Monday where we had conversations with the members of that group, which includes the city manager, the town managers, both hospital systems, emergency management, the sheriff's office, the court system, CMS, and Medic, to sort of have a conversation about where we are as a community, what our metrics were showing us, and made a recommendation that the Board of Health adopt a public health rule requiring a mask mandate. And with that, I will turn it over to Gibby so she can make her presentation to the Board of Health.
Excuse me, Gibby, before you start, I'm going to take a moment of personal privilege to explain and clarify another issue that has been floating in the community that is not necessarily accurate. And that is a statement that was made that a policy group is making the decision. Now, the policy group is not the Board of County Commission. They make recommendations. So the policy group did not enact a mask mandate. This is simply a recommendation coming to the Board of Health from the policy group or the policy advisors. But policy is made by the Board of County Commission. I just wanted to clarify that. All right, thank you, Gibby.
Good afternoon, Mr. Chairman, Commissioners, and the manager, everyone present. As you know, we have been consistent in working under governor's executive orders for over a year now as a county, including our towns and the city, as well as the unincorporated areas. On May 14th, the governor lifted most requirements for mask mandate in his executive order. He kept a few things in specific to health care, to child care, to congregate settings, but the majority of the mask mandate was lifted on May 14th. Over the past 6 weeks, we have seen an escalation of the COVID-19 situation in Mecklenburg County. The Delta variant is responsible for a lot of that. It is now obviously the primary variant we are seeing in Mecklenburg County, in North Carolina, and in the country. It is incredibly infectious and transmissible. We're seeing evidence of that every day. So just to give you a comparison of where we were at the end of June and where we are here in mid-August. So at the end of June, we were experiencing minimal to moderate community spread. As of a number of weeks ago, we escalated quickly into substantial community spread. Our cases went from 44 per day at the end of June to 473 per day in the middle of August. Our hospitalizations went from 39 a day to 260 a day. Our positivity rate went from 3.1% to 13%. We're also seeing predominantly that our cases are in our younger populations. Over the past 3 to 4 weeks, we've seen 50% of our cases in 25 to 39-year-olds, and 20% of our cases in 0 to 17-year-olds. There's been a steady increase in our number of cases, our case count, and our percent positivity rate. Late June, we had 45% of our population fully vaccinated. It has taken us, since late June, to get to 50% of our population fully vaccinated. We are seeing increases in the number of people vaccinating. It is just not happening quickly enough. We know that our hospitals, as well as Medic, is feeling the strain of the increased cases, in addition to other situations that they're dealing with in people's health in Mecklenburg County. We're hearing from our hospitals that staffing is the major issue. So we've got staff who have been working at this for a year and a half. We're also seeing some outbreaks in our hospitals, just like we are everywhere else in our community because of this variant and how transmissible it is. Our hospitals are working to coordinate diversion to make sure that Medic are taking people to the hospitals who can best accommodate them. So they're doing what they can in that area. Their emergency rooms are crowded right now. So at this point in time, they believe they have it under control. They believe they still have some options of increasing their capacity. So we're not at a level yet where we have to start considering other options, but we are in a situation where we need to get this under control so that it doesn't increase strain on our hospital systems. Just today, the CDC released 3 studies in the MMWR. What these studies are showing us is that there is, and I need you to listen to all of this, not just part of it, because if you get just the first part, you don't get the full story. They're showing decreased effectiveness of vaccines against infections over time and with the Delta variant. So in other words, people who are fully vaccinated are more likely to be able to be infected by the Delta variant, even though they're fully vaccinated. But what they're seeing also is that there's still effectiveness with these vaccines against severe illness, hospitalization, and death. So these vaccines are doing what we need them to do. People who are fully vaccinated, who are becoming infectious, are seeing sometimes asymptomatic completely, sometimes, most often, not severe illness. So we know that's what we need it to do. We need it to prevent people from being hospitalized, from dying from COVID. So that's good news. The bad news is that when they become infected, they become infectious. So even though they're fully vaccinated, they can still infect other people in our community, and that means other people who are not vaccinated, as well as other people who are vaccinated. So we need to keep that in mind, and the studies are proving this. We are seeing multiple studies being done that are showing this to us with data to prove it. We now have 150,000 plus children who are getting ready to return to school. In addition to that, we have Labor Day coming down in the next couple of weeks. What we saw in Labor Day last year was after a couple of weeks of the holiday, we started seeing our numbers crawl up, and they continued to crawl into 2021, up and up. We don't want to see that again this year. So what we need to do, if we are going to keep our children in school once they go back, if we are going to prevent overwhelming our healthcare system, and if we are going to keep our businesses open and our economy thriving, we have to control community spread. And the way we're going to do that is with vaccines and with masking. It's going to take both right now, especially as we are seeing people who are fully vaccinated becoming infectious. So today what we are doing is recommending to this body as the Board of Health that we implement a rule that will require masking in all indoor public spaces in Mecklenburg County, the entire county, city, town, unincorporated areas. So that is our recommendation to the board.
All right, thank you. Madam Manager, do you have anything else to add before I open the floor up?
Not at this time.
All right, so the way I'm going to proceed, since you're still there, Gibby, I'm going to allow board members an opportunity to ask questions. I'm sure all of them have some. We'll do it in some kind of order. And up to 4 minutes for questioning and answer. You'll get one round, and then we will open it up to those who have signed up to speak, either for or against the mandate. If you are present and you have not signed up, you can still come down and see the clerk and do so. So at this time, I'll start with Commissioner Lee Altman.
Thank you, Mr. Chairman. Just so I'm clear, so commissioners will get the 4 minutes, and is that all?
That's it.
Okay. Respectful dialogue is needed in civil society, and I want to acknowledge those people who have communicated genuinely felt concerns on this issue by telephone, by email, and I'm sure we'll be hearing it in the chamber this afternoon. For me, it is critical that our public health policy decisions are driven by science, not politics. So with that as our guidepost, we know since the end of June we were at 3% positivity. We are now at 13%. At our very worst last winter, we topped out at 16%. So this is just to make clear to you that we have a tremendous amount of community spread approaching our highest historic levels, and we are not even into the cold season yet. Some mask opponents respond that we have a vaccine now, but as you heard the public health director just say, the vaccine is unavailable to 185,000 of this county's children, for whom it is not yet approved. Earlier in the pandemic, it appeared that young children were not frequently infected by the virus. Now, however, 1 in 5 COVID cases in our area are in children. Over the past 2 weeks, we have seen the fastest rise in pediatric COVID cases, more than at any time in the pandemic. I am told we are seeing more admissions of children with severe acute respiratory illness from COVID at our children's hospitals in this area, and the pediatric deaths from COVID have been reported in our area in the past week. Last, this can strike any child, as 46% of children hospitalized with COVID had no underlying medical condition. I am the mother of 2 children attending our county schools. I feel I must act to protect this community's children, not only to protect their health and the most vulnerable in this community, but to lower the infection rate in our community so we can ensure kids' ability to go to school in person. Children have suffered greatly from isolation over the course of this pandemic, and they have suffered profound learning loss. We need to protect kids' ability to attend school in person. We must protect our local economy and small businesses from a future shutdown. We must reduce our community spread of this virus, and so I will vote in support. In my time remaining, I would like to ask the county attorney if he can help provide clarity to the public regarding our authority in the ETJ versus countywide, because it's been confusing, and I think members of the public would benefit from understanding what we've said in the past around this subject and how we're able to take this action today.
Thank you, Commissioner Altman. The question is, what's the authority of the county depending upon what actions being taken? When the COVID initially hit, we filed an emergency proclamation indicating that there was an emergency within Mecklenburg County as well as the state. Under 166A, which is a statute which allows that, it says that any authority that the county has is only applicable within the ETJ area within the county. And so to cause our proclamation to be more effective, we asked the city and the towns to sign on, which initially they did. And so then that proclamation became, in effect, countywide. So the difference there is that it is under the Emergency Management Act under 166A. This provision is under 130A, which is different. And each statutory requirement has different rules that would govern any behavior by the governmental entity. And so when it comes to what we're doing today or what we're recommending to the board today, and that is the Consolidated Human Services Agency, is to consider this rule so that it would give the Board of Health authority because of the imminent hazard, as you've heard the Public Health Director indicate, because of the nature of what's going on now, and the decline and now the increase of the virus among various individuals within the community, that this rule would be effective to hopefully reduce the spread by requiring the mask mandate. So the difference is, one is when it's on the 166A emergency management, and that's still proclamations in effect, and the other is now coupled with that 130A, which broadens the authority of the Board of Health to pass this rule to require mask mandate in light of the fact that the numbers that were going down are now starting to increase.
All right, thank you. Commissioner Coppin. Commissioner Coppin.
Thank you, Mr. Chairman. I appreciate you calling on me. I'd like to start off with a little bit of a history that I have brought up since I was a new commissioner in 2012, just so the public knows that I disagree with our structure as the Consolidated Human Services Agency and as the Board of Health. I wish we had a real Board of Health with professionals, retired people who are professionals in health that could really advise us. But anyway, that's where we are. So I've said that many times over the years, so I just wanted to say it one more time. I have listened to people on both sides of this equation, and both sides of the people make good point. They really do. But there was one point that really stopped me in my tracks, and that is we are going to force the 6 towns to go along with this. They are independent bodies of government, and I have talked to several of the mayors today, and over the years, I've visited those towns and gone to their meetings, and people who move there like to be in a small town, and I cannot support anything where we're forcing another body of government, the 6 towns, to do what they may not choose to do. And there's also other reasons, but because of that, I am not going to support this. And I think that I keep hearing we have to follow the science, but, you know, we've all lived through a very difficult time. And there have been a lot of mistakes made, and that was okay. Everybody was doing the best they could with the information they had. But we all remember when it started, you know, it wasn't this or it wasn't that, or in the beginning, the mask, it was like, well, the only ones that were good were the N95s. And then it was like, oh no, you can't use that. That's just for the healthcare people. And then it was the social distancing, and it was washing your hands. And now we're just talking about one thing. Why aren't we talking about, you know, social distancing? Why aren't we talking about sanitizing your hands? There's just a lot of, the people have kind of like had enough. But what really is making me vote no, that is because I think we're on a dangerous precedent to ever force the towns to override the towns. I am not comfortable with that. I respect them. They are my friends. I cannot do that, even though I know some of the people in the towns maybe might want the mask mandate, but it's the principle of the thing. It's the principle, and I can't override that. So that concludes my comments. Thank you, Mr. Chairman.
Thank you. Commissioner Ella Scarborough.
No comment, that was fine.
All right. Thank you. Commissioner District 1. Commissioner Powell.
you, Mr. I had to unmute. I have one question for Gibby. Gibby, can you tell the process of happens when any person, staff member, patient, citizen, has a positive PPD?
I'm sorry, you broke up a little bit. Can you repeat that?
Can you talk about the legal process that happens for patients or citizens or staff who test positive for a positive PPD for tuberculosis?
Sure. So TB is one of those conditions that is spoken to very clearly in communicable disease law as well as our policies and procedures. If someone tests, well, if they have a positive PPD, which is the skin test, then we do further testing to see whether they actually have active TB. Just because you've got a positive PPD does not mean your TB is active. It means you have the germ in your body. There are a number of people that carry it around in their body, but it just takes some trigger that causes it to become active tuberculosis. So that's the next step, is to actually do an assessment to determine, and that includes a chest x-ray and a full assessment to see whether they're actually positive or not. If they actually have TB, then what we are talking about is issuing an isolation order that gives them specific guidance on what they need to do. And that includes the treatment that they need to take, how often they have to take it. We also, as part of that, we're expected to do directly observed therapy to make sure they take the medication. And because of the isolation order, if they don't comply, we have the ability to, if necessary, to jail them or put them in hospital if necessary to make sure that they fulfill that treatment. The nice thing about TB, as opposed to something like HIV, if there's anything nice about TB, but the good thing about it is there is a treatment for it and we can cure it. And once that person's cured, then they're released. So in a nutshell, that's the process that we go through.
You're muted, Elaine.
No.
Elaine, you're muted.
No.
Madam Clerk, did you stop her time? Elaine, you're muted. All right, while we're waiting for Elaine, if you'll stop her time, we'll go back to her. Let me go back to somebody. Commissioner Lee.
Let me first say thank you for this opportunity. And let me clarify, I am not a medical doctor, nor a registered nurse, but just a good citizen who wants to make sure that my community is safe. And when I say that in terms of providing what's necessary to help us to maintain a safe community. When I heard you mention the fact about tuberculosis, that came to mind, and several people talked to me about it and what the repercussion is. You did not mention the fact that anybody who taught in the school system had to be given the shot before they could work at the beginning of the school year. It's not a matter of whether you want to be, ought to be, or what. That's a part of the law, that you must be given that injection before you can teach in the public school system or in any school system with children. And some people say they're teachers when they haven't taught in a school system, but they taught Sunday school. So I'm not sure about that ramification. But as it relates to working with children, you must have that injection. So that, to me, says to us that the law does tell us what to do. It does say that if you're teaching, you can't teach. It doesn't say you might want to teach and come back and get the shot later. You can shake your head all you want to, it does say that in Mecklenburg County. Now, maybe where you came from it didn't. So what I'm saying to the public, and especially to District 2 and my seniors, they're the ones who's wearing the mask. The young people are not wearing them. People who moved here last week or 2 years ago or 5 years ago are not wearing the mask. And many of my seniors are talking about people they lost because of the virus. And you can say they haven't died. I know I witnessed several of my friends who've died because, let me turn this way because this lady's distracted me saying I'm not telling the truth by shaking her head.
Commissioner Leak, if you
These are my friends I'm talking about, not your friends, my friends who have died. And if they had been able to get the injections, which they had not, and the wearing of the mask was not as prominent as it is today, maybe their lives could have been saved. I don't know, I can't speak to that. But I do know that I've received telephone calls, not from black people, but white people telling me not to vote for this. And the greater number of people who are dying are black folks are dying because of it. Am I right?
Over the last several weeks, 50% of all of our deaths
I can't hear you.
Over the last number of weeks, 50% of our deaths have been among African Americans.
Exactly. And when we began the process of making sure that communities were being given the injections, we didn't start on the west side of town. We started in Huntersville. We started in Cornelius. So I worry about all of the ramifications that's been a part of this when it became very political. We didn't make it political. Washington, D.C. made it political. Washington, D.C. made it political with Trump saying what he had to say. So I'm saying what I have to say, Mr. Chairman.
All right, thank you.
It was political. Is my 4 minutes up?
Your time is up.
Thank you.
Commissioner Meyer.
Thank you, Chair. I do have a question for Gibby. I'm going to speak my piece, and then I'll ask you at the end. During World War II, Americans united for the greater good, and they sold their valuables for the war effort. Women went back to work. And one event that I personally remember when Americans united and dropped politics was after 9/11. We became unified as Americans. We held each other up. We leaned on each other. We were united. This should be one of those times. The pandemic is not selective, though it does absolutely affect others more than some. I acknowledge that 100%. We are in this together. We should work together and we should protect each other. We should be holding each other up and accountable. It is so simple. All we have to do is wear a mask. When you're in public, wear a mask. It's not complicated. It's also not violating your constitutional rights. And some of my emails have had the audacity to compare a mask mandate to slavery. Shame on you. This body before you, we are not here for the power and the money that many of my emails have suggested. I laughed at that, as I'm sure some of my colleagues did as well. I'm certain they got a good laugh at it. I want to assure my constituents that I ran for this office because I wanted to make a difference. And when I make a difference, I have to make hard decisions. And right now we are in that situation where I have to make a hard decision. Public Health Director Gibby Harris said over and over, we hope the community will do what they need to do. And sadly, they did not. Our community did not get vaccinated. A little over 50% is vaccinated. And those who don't wish to be vaccinated, many are not wearing masks. And so here we are. Our positivity rate is dramatically increasing and our hospitals are being burdened again. So therefore, here we are, making those hard decisions. Masks do work. They are not 100%. but children under the age of 12 are unable to get the vaccine. I don't think it's asking too much to do our small part to help the children of our community. It's for the great.
Commissioner Lara, this is my first and last warning. If you continue, you'll be removed.
Thank
Continue.
you. This is for the greater good of our community. Our restaurants are thriving, our businesses are open, and because we are masking up, they're going to continue to thrive and they're going to continue to be open. School is starting. College students are moving in. Young people are out and about in bars. Businesses remain open, and as I said, restaurants are thriving. Let's keep it that way. Wear a mask. I'm going to vote yes. Gibby, one of the arguments I hear on email is masks don't work. Can you speak to the effectiveness of masks?
There have been a number of studies done that show that masks are, nothing's 100%.
Right.
I will admit that right off the bat. The vaccines aren't 100%, masks aren't 100%, but the evidence shows that they do present a barrier that prevents transmission and prevents you from being exposed. So the evidence is out there. The CDC is strongly encouraging. They can't mandate in our communities. The governor in the past has mandated masks, and at this point he's leaving that up to our local communities to do what they need to do based on what's happening in our communities. But the evidence is there that masks work.
Thank you. That concludes my comments.
Thank you. Commissioner McDowell.
Thank you, Mr. Chairman. I really appreciate your comments, Commissioner Meyer. Thank you for those. You know, our security, including our physical security, our financial health, are codependent upon one another. Our schools, our courts, our businesses, we need to put them in a position of strength, not weakness. The anti-mask crowd is loud. I hear you. I've been listening, I've been answering the phone. I've been answering emails. I've been reading dozens and dozens of emails. I just don't understand this tying to liberty and freedom that I hear over and over again. I don't know how there can be liberty and freedom when disease is allowed to run rampant. That doesn't make any sense to me. I'm going to be voting in favor of this, but I want to speak to a couple of things. The town issue. I have 3 towns in my district. I don't view this as forcing a body of government to do something. Our towns do not have their own boards of health. Mecklenburg County is the responsible body when it comes to this topic. So I don't see this as taking away any power or jurisdiction from our towns. I do have a couple of questions I would like to ask Gibby. The first one is there a target to lift the mask mandate? Can you speak to that? I'm going to just get my questions out and then I'll mute myself. I hear the feedback. So number 1, what's the target for lifting the mask rule? Number 2, you talked about the decreasing effectiveness of vaccines against the Delta. Is it also decreasing effectiveness against the original strain? And my last question is, what are the loopholes? Does this apply to private school settings? And what are the loopholes around this health rule? Thank you. Those are my questions.
So yes, there is a section at the end of the rule what we are attempting to do, because we understand that Delta is probably, that coronavirus, the COVID virus, is here to stay for a while, and that we might see peaks and valleys like we have seen up to this point. What we tried to do is write this in a way that the coming and going of mask wearing is really dependent on what we're seeing in our community. So what we are planning, what is in the document right now speaks to if there is high or significant transmission as defined by the CDC, then we wear a mask. If we get to the point where we drop below those levels, then we'd come back to the board and ask to suspend the rule. If we go back up again, we would come back to the board and ask to implement the rule again. And we would reevaluate at least every 30 days. So that is the intent around that. In terms of private schools, for example, in the document, it speaks to all public indoor spaces. That includes private entities as well as nonprofit grocery stores, you name it. So private schools are also included in that. And yes, there are some exceptions that are consistent with what was in the original governor's mandate for masks. There's a whole section of them. I can get the document and read those off if you need me to, but we wanted to make sure that the exceptions existed where they were needed. So yes, there are exceptions. And there's also some specific language in there that explains, when you're eating and drinking, you don't have to wear a mask, obviously. Those sorts of things. So it clarifies that as well.
Okay, the one question I didn't hear you address was about the original strain versus the Delta strain.
That one, yes, thank you for the reminder. I've perused quickly these studies. They did not specifically speak to Delta. They spoke to the ability of what we know is the Delta is the most infectious and transmissible variant, and it's the one that is the highest, the greatest amount in our community right now. So I'll look at that in more detail and let you know, but I would assume that it's probably the same with the other variants as well.
Thank you.
Mm-hmm. All right. Let me start out by saying I have heard from a number of people. I won't say quite a number of people. I've had a whole lot more people call and a whole lot more people email on issues that I thought were not as controversial as this particular issue. But I have read my email. I have listened to my phone messages. And whether we agree or not, the bottom line is somebody has to make a decision. And everybody can't have it their way. The Board of Health for Mecklenburg County is designed to make health rules for Mecklenburg County. If you are in a township within Mecklenburg County, the Board of Health rule applies to you. So as relates to these townships that have their own boards, those same boards will make decisions, some of whom their residents will agree with, some their residents will not agree with. But their rule would be their rule. And for those who like what they say, you're happy. For those who don't like what they say, you're happy. But that's why we have the Board of Health. It applies to all of Mecklenburg County. So while I've heard what everybody had to say, let me tell you what this is not, because I read a lot of stuff that wasn't accurate. This is not a stay-home order. Nobody's being told you can't go out. This is not about fining you to increase the amount of money that we receive in our budget. Nobody's mentioned a fine. This is not a demand that everybody get vaccinated. We respect people's right to do that or not, even though if it were our choice, we would do that. No different than you are required to take other kinds of vaccinations. You know, there comes a time when those of us who are elected, and I would say to those who have different opinions, who want to make these decisions, that you should go get elected. But we have to do what is best for the community, whether you agree or not. And yes, I've heard the threats. You'll move out of Mecklenburg County. There are probably places who would welcome you and welcome your ways. But in Mecklenburg County, the county health rule is what applies to everybody for the good of Mecklenburg County. So people would ask, well, why do you make it apply to the whole county? It's real simple to me, to be consistent. Nobody's going to go outside the city limits of Charlotte, take their mask off and go into another township and put their mask on, and go into another township and take their mask off. The rule is consistent with everybody. And so if this is adopted, we expect everyone to comply. And woe is he who fails to comply, who gets the virus, and that be their death knell. Because my guess is, and it's already happened, a lot of people said no. And as a result of it, people died who didn't have to die. It's our goal to see that there is no more death in the county of Mecklenburg. All right, so we've had people to sign up. We have been respectful to our audience.
Chair Dunlap, you were going to go back to Commissioner Powell.
Okay, Commissioner Powell, you had how much time? We're going to give you 3 minutes. Commissioner Powell.
Thank you, Chairman. Can you hear me now?
Yes, we can.
Okay. The reason that I asked about the tuberculosis is because when we have an infection, an airborne illness that is contagious, there are laws to make sure that we have measures in place to protect public health. Public health plays a vital role in disease control and prevention, which is why our county has a public health department. And we are responsible for protecting the public. And I just, if we weren't responsible, we wouldn't require restaurants to be inspected and many other things that we do, pool inspections and other things that code enforcement. But it's important, exactly like Commissioner Meyer said, instead of being divided and fighting about this, how can we come together and problem solve? And it's such an easy ask. I do want to say that I have read all the emails and listened to all the phone calls, and I really appreciate everyone's input. And I am concerned about people that have respiratory distress, struggling. I don't want anyone to get bullied over this. I know that it's hard for people that have respiratory distress. I know it's hard for people that are hearing impaired. And so those are written into this document. The mask mandate is sensitive to that. And I just hope we will all work together to solve this problem so that we're not here next year talking about the same thing. Thank you.
Thank you, Commissioner Powell. All right, as I was saying, unlike some of you, the board will hear your concern. We will be respectful. We will not talk while you're talking. out of respect, and I realize that some of you are not only disrespectful in this chamber, but that's your disposition. So, as I call your name, you will go to the respective mic that's available. You will have up to 3 minutes. Up to 3 minutes, not any second after 3 minutes. Arash Shamani is in person. Where is she? Arash Shamani? All right. Jacob Barnett. Jacob Barnett. Matthew Childs. Jessica Herrick, will you go to the opposite mic?
Thank you so much for having us here today to speak. I appreciate it. I trust that you have our local society's best interest at heart, as much as I trust your belief in the American values of self-determination and personal responsibility over our own bodies. To that end, a blanket mask mandate that seems untethered to data and statements by public health experts operates in conflict with those values. The events of the last year and a half have created great reputational damage to most public institutions. Americans are bobbing and weaving as a cascade of shifting policy decisions, each of which we are to regard as absolute truth, at least until the wind changes, causes confusion, misery, and eventually a lack of interest. At some point, I fear no one will listen to anything what the experts have to say. With respect to the county health director, I didn't hear much data given about the relationship between mask usage and infections. And so we have no way to know if masks even affect the disease. We also don't know we don't even know if mask mandates lead to more mask usage. So we don't even know the relationship there. So we know that cases are going up, but we don't have any idea whether masks have anything to do with that or down. So furthermore, one reason we disagree with the proposed mandates is the wealth of information we can find on the internet. As opposed to what the local hospital chains and the county director are recommending. On CNN just last week, we heard the director of the University of Minnesota Center for Infectious Disease say, "We now know that many of the that's a quote, "We now know that many of the face cloth coverings that people wear right now are not very effective in reducing very much of the virus movement in or out." In February of last year, Dr. Fauci, who has been studying coronaviruses for decades, emailed his personal friend to say, "The typical mask you buy in the drugstore is not really effective in keeping out the virus, which is small enough to pass through the material. It might, however, provide some slight benefit in keeping out gross droplets if someone coughs on you." He went on to say, "I do not recommend you wear a mask." This is Dr. Fauci, which is very different from what he was saying in public. Again, these statements conflict with the recommendations of our local hospital networks which they've given you. People are going to disagree, but it is this mysterious and ongoing messaging fiasco that is causing confusion and distrust between you and us. It's not because we're stupid. It's not because we don't care. It's because we want reality. And nothing is real these days. Everything is fake. Nothing makes sense. We want to trust government, and we want government and institutions that are effective, that are consistent, that create trust. I had COVID just a few months ago, so why would I even need to wear a mask? It makes no sense. In fact, knowing what we know all about coronaviruses, the message from government should simply be, get some exercise, take your vitamin D, and stay home if you are sick. When the effectiveness of masks is in doubt and blanket policies are based on the whims of whichever...
Your time has expired.
Okay.
Jessica Herrick. Jeff Johnson. Doug Lockerbie. If you'll take the other mic, please, sir.
Mr. Chair, Commissioners, appreciate your time today. I'm a local business owner. In early 2020, we shut down our businesses. We let employees go. We lost an immense amount of money, faced a lot of financial hardship. My son was slated to be the lead in a local theater company play. We canceled that. My daughter was supposed to go to college in D.C. They shut that down, so we have suffered immensely. Okay, I'm lucky. I'm an entrepreneur. I get to work from home, so I don't have to deal with a lot of the things that most of the folks in Mecklenburg County have to. I will tell you this, that do you remember the story of the boy that cried wolf? I'm going to tell you that's what this feels like to me, okay? The government, you folks, the governor, the federal government continue to cry wolf. First it was coronavirus, right? First it was the alpha variant, 99.3% survival rate, right? Now it's the Delta variant. When is this going to end? How long are we going to keep doing this? Every time you do it, you lose credibility. I need you to understand that. We were compliant. We wanted to be on board like everybody else. I want to save kids' lives. I'm all about that. I would never do anything to harm a child or harm another person. But this is getting out of control. It's getting out of control, and it feels tyrannical. It feels tyrannical. Listen, if I go into a store and they require a mask and I want to be in that store, sure, maybe I might put a mask on, but I'm going to tell you what I'm going to do instead. I'm going to go to a different county or I'm going to go to a different state, just like I did before, and I'm going to spend my money there. And Mecklenburg County businesses are going to get hurt again. I know many people that went to other counties and they went to South Carolina to spend their money, and guess who got hurt? The local businesses, okay? And that's what's going to happen again. You've already mandated masks for kids in school. I don't agree with that. But if you want to put your kid in public school, you got to put a mask on them. I think it's a sad thing. I think it's child abuse, but that's my opinion. And history will tell us the effects of the decisions that are made in this chamber. And a decision to mask people up, to put a mandate on people, to put a mask on their face, to me is tyrannical. And I will not comply. I will spend my money elsewhere. So that is all I needed to say to this chamber.
Hi, I'm Stu Lockerbie. Thank you very much, all of you, for your service to Mecklenburg County. I'm here to address the mandatory mask wearing inside the buildings throughout the county. Now, we've heard, and I think we've all been grateful to hear, that the board desires to make their decision based on the science. And unfortunately, I haven't heard much about science. And we know from Dr. Fauci from a year ago that there's a difference between anecdotes and science. You see, there's been one large, randomized, controlled trial that specifically examined whether masks protect their wearers from the coronavirus. However, there have also been hundreds of mass studies related to the common flu virus transmission over the several decades, so they've studied this a lot. The conclusion by the CDC, after reviewing all of the studies worldwide, found, quote, no reduction in viral transmission with the use of face masks, end quote. However, these studies did demonstrate that masks actually trap bacteria on the inside of the mask and thus continually expose the wearer to their own bacteria. Furthermore, studies have shown that the use of masks actually decreases the oxygen in the blood and increases carbon dioxide within the blood. That's the science. The science is that if you mandate mask wearing within the county, you are going to create a self-fulfilling prophecy. More people are going to get sick. That is based on the science, not based on someone in a lab coat who doesn't treat actual patients from COVID. So if masks don't work, what shall we do? You are caring people. You want to do something. What do you do to stop the spread of a virus that that has over a 99.5% survival rate. Well, I wouldn't recommend an injection whose death count, based on VAERS, is around 10,000 officially. And unofficially, based on a Harvard study done a few years ago, we know that that number can be inflated to potentially hundreds of thousands, possibly millions, because they did a study that of the actual amount of adverse reactions, only 1 to 10% get reported. So you might consider instead stressing proper hygiene, a healthy immune system, through supplements of vitamin C, D, zinc, and either hydroxychloroquine.
Thank you, sir.
That would be effective.
Thank you, sir. All right, Stephanie Franks.
Could I approach? I just want to.
You'll give it to the, excuse me, sir, if you'll give it to the clerk. Stephanie Franks. Tisha Henderson. John Hodeman. Michelle Hodeman. Revantha Marta. Who?
Oh, they're online.
Oh, they're all online. Ah, ha, ha. Let's go back to Stephanie. All right, Stephanie, you have up to 3 minutes. Stephanie, you'll need to unmute yourself. All right, Stephanie.
We do not have a Stephanie in WebEx.
Okay. Tisha Henderson.
No Tisha Henderson.
All right. John Hodeman.
We have a John H.
All right. That's him. Let's let him talk.
Good afternoon, everyone. I have some serious concerns about the proposed mask mandate that is demonstrating the scientific illiteracy of our so-called leaders. Now, to be fair, it must be very scary for them to see their whole worldview crumble piece by piece. We are on day 570 of 2 weeks to flatten the curve. We are on day 210 of 100 days of masks. We were told that masks don't work until we were told that they did. We were told that no one should take a rush-through Trump vaccine until we were told that only enemies of the state won't. We were told that we'd go back to normal once the vaccine was available until we were told that we couldn't. We were told that the vaccine would protect us until we were told that we could still catch it and spread it. We were told that hospitals were overwhelmed until we were told that thousands upon thousands of healthcare workers all over the country were being furloughed during the peak of the pandemic. We were told that frontline medical professionals were strained to the breaking point until we were told that Charlotte's 2 largest medical systems are willing to fire up to 30% of their staff for not getting a vaccine that we're now being tacitly told isn't very effective. And despite all of that, we have watched as every single one of your mandates and lockdowns and interventions produced failure after abject failure. COVID ripped through the population anyway. Public health officials insist on using garbage in, garbage out statistical models to support their mask mandates. They call these studies. But in the only randomized controlled trial done, the gold standard of science, they were unable to find any statistically significant difference in COVID transmission between wearing a mask and not wearing a mask. None. According to state aggregated data reported by the New York Times, there is exactly 0 statistically significant correlation between the stringency of non-pharmaceutical interventions and per capita COVID hospitalizations and death. None. Here's the thing. I'm not against anyone wearing a mask, just like I'm not against anyone wearing a magical amulet to ward off evil spirits. If it makes you feel more comfortable, go right ahead and do it. But you have absolutely no right and absolutely no scientific justification to force your superstitions on anyone else. This is an unjust order. And as Martin Luther King Jr. said, one has a moral responsibility to disobey unjust laws. I will not obey your mask mandate. I will not submit to your arbitrary rejection of science. And I urge everyone here not to comply. These so-called leaders are abusing their power, and it is morally unjust to allow them. I will not wear your mask.
Thank you. All right, is Michelle Holderman around? Michelle Holderman?
Michelle Holderman is here.
Marta?
Michelle Holderman is here.
Okay, Michelle?
I'm Michelle Hudeman, and I'm a resident of Charlotte. When I reflect on everything that has happened the last 18 months, I see one fundamental error, and that error is the unscientific belief that we as human beings can outsmart a virus with our intelligence and our edicts. It's a fantasy to think that we can somehow mitigate COVID-19 through stay-at-home orders, mask requirements, and other mandates, because that's not true. We can't. It has not worked and will not work. If mask mandates worked, we would not have seen a surge like we did last summer and last winter when mask mandates were in place. It's like the saying goes, the definition of insanity is doing the same thing and expecting a different result. It's not just Mecklenburg County. The reality is that COVID mandates have not worked anywhere in the world. And it doesn't take a scientist to notice this. Every day, more and more people are made aware of this reality. There are piles of studies and countless charts that make it abundantly clear that mandatory masking, lockdowns, and other mandates have no real-world effect on curbing the virus. And fortunately, we have a controlled group, Sweden. They've had no mask mandates, kept kids in school the whole time, and avoided the collateral damage of destructive COVID policies. You think they'd lead the continent in deaths, but they don't. Most European countries have higher death rates per capita. So with all due respect, at this point, you would be wildly delusional and arrogant to think that the policies you dream up can actually mitigate COVID-19. People now know they were misled and that all the restrictions were for nothing, and they are furious. We have to take a step back and realize it's not March of 2020 anymore. We have 18 months of data that tell us the risk of COVID are vanishingly small for the vast majority of people. There's no need to continue the hysteria at this point. I also must point out that there is not a single randomized controlled trial that demonstrates the effectiveness of masks. Their usage in everyday life has been questioned by a growing number of doctors and scientists, including President Biden's former COVID advisor, Michael Osterholm. And we cannot forget that masks are harmful to many. As someone who has family members who are hard of hearing, I can tell you that masks make day-to-day life incredibly frustrating and unnecessarily challenging. As a mom of a young child, I can attest to the psychological and developmental damage that a masked world does to children. Masks are also harmful to people who are neurodiverse, lonely, have respiratory conditions, the list goes on. County officials, it's time to rise above the COVID hysteria and have the humility and the wisdom to understand that your mandates cannot and will not stop the virus. You can be someone who is clear-headed, caring, and courageous. You can be someone who does the smart thing and the right thing if you do not mandate masks. Thank you.
Rebecca Marta.
I'm sorry, repeat the name.
Rebecca Marta. Or Matter.
I don't see that person.
All right. Dr. William Mitchell.
I do not see a Dr. William Mitchell.
Okay. Jacob Packett.
Jacob Packett is here.
Mr. Packett.
All right. I am here. Hi, everyone. My name is Jake. I live here in Mecklenburg County, and I wanted to bring up a couple of points that are pretty important to bring up. When the board was speaking earlier, just about every point that I'd heard was particularly anecdotal and emotional in response. And that's, I'm sorry for the people that you've lost. I'm sorry for the things that you've had to navigate. But at the end of the day, what you have to go through does not need to be mandated on the rest of us. I want to bring up that there was something that was mentioned about the Delta variant spreading so fast and how the Delta variant is just so dangerous to all of us. Did you know that per the CDC, that you actually, if you get a positive COVID test, you have to send it off to a lab to be further tested, so that way you can sequence that particular strain of the virus to find out if it is in fact the Delta variant that you contracted. Never mind the fact that we've changed the way that we test. Never mind the fact that we've known for some time that the PCR tests were too sensitive. So we actually don't know if the spike in cases is a result of specifically the Delta variant, because every person that gets tested, we don't actually know. You'd have to do much more testing to find out if it's that variant. Another thing is I want to bring up some other data. When we look at places like Israel, one of the most vaccinated nations in the world, they had a mask mandate on April 12th of last year. And then we saw that they doubled the mask fines and increased enforcement in around the 24th of June last year. Then they had a spike in cases. That spike in cases went down as it did for May and November of last year. Wall Street Journal felt the need to say that masks brought the curve down after that point. Never mind the fact that there was a spike. We can see the same thing happening in places like San Francisco and Hawaii, where mask mandates usually result in a spike in cases that happens at the same time as other places of the world, specifically San Francisco, mask mandate April 17th of last year. They have a huge spike in cases between November and December, just like many other places in the world. And then they lift the mask mandate on the 15th when the cases naturally go down. One other thing I want to mention, as I'm sure I'm getting close to my time, is we're talking about things like public health. COVID-19 was not the #1 killer in the year 2020. It was heart disease. Do you know the best way to prevent things like heart disease, and also to make sure that you don't have a deadly case of COVID-19, is to be able to make sure we manage things like waist to hip ratio, making sure that we exercise, that we eat well, that we make sure that we take vitamin D, that we get out in the sun, that we manage our body fat percentages. And there's no talk of that. There's no concern for the overall health of people. And so I just want to make it absolutely clear, I will not comply. I will not comply. I will say it one more time just in case I stutter. I will not comply. I will not be a jerk to people who are trying to comply. And if they won't allow me to shop in their store or go indoors in certain places, then so be it, I'll go somewhere else. But you need to know, I will not comply.
I'm trying to determine if his name is already on this list.
It looks like he's on there. I guess he just didn't get the link initially. So
Okay. So, Dr. How do you pronounce it? Promzadian? Dr. Aaron Promzadian. Okay.
He is here.
All right, thank you.
So my name is Dr. Aaron Regresan. I'm a board-certified emergency medicine physician. I have a master's in healthcare administration, healthcare leadership. I am wearing a lab coat, and I do treat COVID patients. I spent 12 years of my life training, learning about medicine to be an expert in the human body and treating illness. I practiced emergency medicine for the last 11 years. In the past year, the officer at Star Healthcare tested over 600,000 patients, vaccinated around 400,000 across the state. There are not many people in this country, let alone the state, directly involved with patients who are exposed or positive as COVID-19. In the past month alone, testing has gone up 400%. Our positive rates have been 2% to 13%. I'll start with an anecdote, since everyone likes to share one. It's a privilege to wear a mask. When the pandemic first started, we did not have enough masks to protect us in the hospitals. We reused masks that should have been disposed of.
Can you speak up?
Yes, absolutely. So it's a privilege to wear a mask. When the pandemic first started, we did not have enough masks to protect us in the hospitals. We reused masks that should have been disposed of. We wore those masks to the point where my own blood was on the mask, but I couldn't take it off because there were no other masks available to me. My son was born a few months before the pandemic. I would go to work with a single mask that I had to use over and over again to save patients' lives in the ER. I intubated COVID patients. I told family members that they would never see their family member again. I would come home and I couldn't see my own son. I'd strip in the garage. I'd live in a separate part of my house because I didn't have enough masks to feel safe with. I couldn't touch my own son or feed my own son or change my own son for 4 months until we had enough masks that I felt comfortable to do so. We know that masks work. Physicians have worn masks for hundreds of years. Children are taught to cover their mouths when they sneeze. It is literally the same concept. One of the commissioners stated N95s are only for healthcare workers. Yeah, early on, we didn't have enough. So they reserved it to healthcare workers because we were the most exposed. We didn't know which masks were the best, but I can tell you surgical masks work and N95s absolutely do work. We have studies from local doctors such as Duke that literally just came out last week saying that masks work in schools, that the CDC provides us with scientific proof that it works as well. To the gentleman who had COVID a few months ago, he doesn't realize the virus changes. He's going to get the virus again. His antibodies, his immune system, eating healthy is not going to protect you. The mask will protect you. It's getting out of control because people are not wearing masks and they're letting this mutate. Unfortunately, we've had politics involved and scare tactics about masks used. Masks do not lower your ability to breathe oxygen. They do not increase your carbon dioxide level. I wear a mask 12 hours a day, nothing happens to me. They do not cause life-threatening medical issues. If they did, your surgeon would not wear it for 12 hours a day. I heard a commissioner was saying that there was people with respiratory issues who don't want to wear masks. I can promise you, those are the people who need to be wearing masks because they're the highest risk of dying. We've seen politicians involved in medical public health issues who have poorly affected their communities. We see record number in Florida.
Thank you, doctor. That's
All right, thank you. Okay, next, Nicole Riga.
That was your time.
Do you have Nicole
Doc,
Riga?
can you unmute the room again? I had to mute it for the echo, sorry.
Nicole?
There we go.
You're funny. It's for the smart people.
Okay, do we have a Nicole?
Yep, I'm here. Sorry,
All right.
I didn't hear you call my name. So I am Nicole Reagan. For those of you who are voting in favor of the mask mandate for the good of the community, can any of you prove that wearing the mask are not causing harm? I'm imploring you today to follow the science, not the scare tactics of the media. Stop counting cases and positivity rates and start looking at death rates. Please do not enact tyrannical measures for a virus that has a well over 99% recovery rate. Here's some data from medical doctors, journals, and associations. If you want the links, please reach out to me and I'll be happy to provide them. Published by the Journal of American Medical Association, which is JAMA, face masks should not be worn by healthy individuals to protect themselves from acquiring respiratory infection because there is no evidence to suggest that face masks worn by healthy individuals are effective in preventing people from becoming ill. Published in the U.S. National Library of Medicine, 17 of the best studies were analyzed, and they said none of the studies established a conclusive relationship between mask use and protection against the influenza infection. The direct rebreathing of virus back into nasal passages can contribute to the migration of the virus to the brain. The Association of American Physicians and Surgeons stated wearing masks, both cloth and surgical, are not effective at preventing COVID transmission, whether worn as source control or as a PPE. A prominent neurosurgeon and author, Dr. Russell Blaylock, has stated, by wearing a mask, the exhaled viruses will not be able to escape and will concentrate in the nasal passages, entering the olfactory nerves and travel into the brain. Wearing a mask may cause one to rebreathe the carbon dioxide that the lungs are attempting to expel. Elevated CO2 in the blood and tissues is called hypercapnia, and it's associated with increased risk of mortality. Wearing a mask can increase your risk of infections. A drop in oxygen levels, hypoxia, is associated with impairment in immunity. In essence, your mask may very well put you at an increased risk of infections and obviously much worse. Textile materials used for cloth masks can contain harmful chemicals and dyes. There's no research available regarding the safety of breathing through such materials. There are are so many more studies and evidence that support why healthy people should not be masked. I have mentioned some of the medically related ones. I haven't heard any of you talk about any of the studies that are supporting your mask mandates. I also want to remind you that the CDC is not an independent government agency. In fact, they are a subsidiary of pharmaceutical industry. The CDC owns more than 20 vaccine patents and purchases and sells 4.1 billion in vaccines annually. If you cannot definitively prove that the masks do not cause harm, you have no right to require the public to wear them. The use of face masks should be optional for all individuals in all settings. That's it. Thank you.
Okay, Callie Simpson.
Okay, we're waiting to unmute the room to the next speaker. There we go.
Callie Simpson.
I don't see that person.
All right. Robert Stebbins.
Yes, we have a Bob Stebbins.
Mr. Stebbins.
Okay, can you hear me now?
Yes.
Okay, thanks. So I listened to all these different, I listened to all these speakers that initially spoke. I agree with everything that they said regarding the mask, except for the doctor that just spoke. And I also listened to all your comments, and you say that you want to protect the kids and the spread. And I think everybody on this call supports that goal. But you're associating the mask mandate with stopping the spread, and that's a false connection. Contrary to what
Sir, we can't hear
you've
you when you
said,
turn
the
it
science is very crystal clear that masks do not stop the spread of this virus. And I could sit here and rattle off hundreds of links and studies and videos that support that, but I'll spare you on that. I accidentally did my own study. I knew there were 11 states that never locked down and had no mask mandates, and interestingly, all 11 of those states were Republican governor states. So I found 11 Democrat governor states of the same size and compared their COVID numbers. It showed that 8 of the 11 Republican governor states that had no mandates had better numbers than their Democratic counterparts. Less COVID cases and less deaths. So to me, if masks really do work, I would not have expected those numbers to be that way. I'd expected them to be the opposite. 18 months ago, I was part of my community. I was helping make masks. I was handing them out. Now 18 months later, I hate to break it to you guys, but this gig is up. This gig is up, folks, and we know what's going on, and a lot of the people prior to me on this call were saying the exact same thing. It's time to come clean and face the science. You either follow the science or you follow orders. I remember going to a restaurant having to wear a mask before I sat down and then take it off as soon as I sat down, as if COVID was waiting for me to finish dinner. I mean, these are the absurd rules that we had to follow. I know you're thinking about the Delta variant. You mentioned it earlier. And you mentioned how the Delta variant is much more contagious, which it is. But you also need to know that all the variants are actually much less harmful to people than the original virus. So if that's the case, I don't understand why you're masking us up. So if you really want to end this pandemic, I can tell you exactly what the blueprint is on ending this pandemic. You make the masks optional so that those who want to wear them can still wear them, but those who don't have to. And then you need to get the medical community, including this doctor that just spoke, and make sure that anyone that gets COVID or this Delta variant has access to ivermectin or hydroxychloroquine, along with zinc, vitamin D, and vitamin C. Those protocols have shown to be both, have been proven to wipe this virus out in very short order. Something that these vaccines do not do. And they're not really a vaccine. We all know that. These are shots just like a flu shot. They don't prevent you from anything. That's it. Thank you.
All right, Mr. Jeremy Smith. Jeremy Smith? Do you have a Jeremy Smith?
No. The last person I have is named Henry. That's the last public speaker that I'm showing in WebEx, if they're on the list.
All right. Whoever Henry is, because his name is not on my list, let him speak.
Hey, guys. Wow, there's some fantastic speakers that really did their homework. Not gonna lie, didn't have time. But I do want to share this because the science of this does seem pretty self-explanatory to me. And a certain Dr. Colin Axon, a scientific advisory group for emergencies advisor for the UK government, said this, and I think it becomes pretty simple from here. Ready? Once a particle is not on a biological surface, it is no longer a biomedical issue. It is simply about physics. Masks can catch droplets and sputum from a cough, but what is important is that the SARS-CoV-2 is predominantly distributed by tiny aerosols. A COVID viral particle is around 100 nanometers. Material gaps in blue surgical masks are up to 1,000 times that size. Cloth mask gaps can be 500,000 times the size. Those aerosols escape the mask and will render the mask ineffective. The public were demanding something must be done. They got masks. It is just a comfort blanket. But now it is entrenched, and we are entrenching bad behavior. All around the world, you can look at mask mandates and superimpose on infection rates. You cannot see that mask mandates made any effect whatsoever. Woo! Nailed it! So, what do we do from here, guys? If this whole thing is about mask mandates, the physics show it doesn't work. I would really appreciate it if the government would kind of acknowledge science for once. Amen? And to the one lady that brought up 9/11, I just wanted to point out that after 9/11 and the fear tactics, we got the Patriot Act, we got National Defense Authorization Act section, was it 1021, 1022? And basically we have a surveillance state. Now compare that to Australia, they have a military state. And I kind of see that same pattern starting here. So I'd really appreciate it if you guys would nip this in the bud, all right? That's all I have to say. Love y'all.
Mr. David Olson.
Okay, we just need to unmute the room.
All right, thanks for hearing me here. Firstly, to Ms. Harris, congratulations on your retirement, and I know you mean well with this order, but I don't think it will do the job. So the people of Charlotte, we want the truth, right? We're after the truth, and I know that Ms. Altman, you said you want the science rather than politics. We want the truth over politics, and this religion of scientism, of listening to the CDC, which is just a big pharma arm of propaganda, that's not science. So we want the truth. So I have a few quick points about how we got here and why we're talking about mask mandates in the first place. So firstly, the lockdowns, right? You've all mentioned how we want to keep our businesses open. The lockdowns are being used as the greatest threat that if we don't follow COVID mandates, we're going to all shut down again. No, we're not going to shut down again. It's bad. Number two, there are legitimate treatments that have 100% efficacy in early onset of COVID. Those were censored. The onset of internet censorship occurred when America's frontline doctors went to the White House and talked about their findings. So it's being censored. So that leads me to my third point. The emergency use authorization for these vaccines is illegitimate. They shouldn't be being used. We have legitimate treatments for COVID, and people are dying because we're not using them. So these vaccines that inevitably is going to be your next agenda item, they shouldn't be in use. They're poison. They're killing people. They can reduce some symptoms, but a lot of people are dying, and it's ridiculous. Number four, as was just mentioned, it's an aerosol. It's an airborne disease, the coronavirus particles. This room is filling with whatever is in here right now. The only thing that's going to get it out is air filtration. The mask doesn't stop it. So there's this false belief that was censored that it's just in spit particles and it falls to the ground, stays 6 feet apart. If you're inside and there's no air filtration, you're all breathing the same stuff, and COVID's in there. The mask doesn't do anything. Number 5 is the death rate. Obviously, it sucks that people are dying from a real virus. It sucks, it does. But the death rate was so grossly exaggerated early on to create panic, and we're still going with that same lie today. So finally, these masks, you were asked about the science of the efficacy of the masks. Where's your data? Let's see it. We've all researched it. The masks have little efficacy, and even the WHO's own master guide says that the top two of the top three benefits are making people feel like they can do something by wearing a mask. There's actually no scientific benefit unless it's an N95 worn right. So lastly, look at Australia. What this is a fear-mongering step towards forced vaccines, social credit scores, and taking away all of your liberties. Look at Australia. So resist and do not comply with any of these mandates. Thank you.
All right, to my colleagues, you have heard the discussion. You know that there is a recommendation from policy. Dina, would you take a moment and explain who made up the policy
Sure.
meeting so that people would understand who was participating?
Policy group is made up of myself, the county manager, the 6 town managers, the city manager, representatives from Atrium Health, Novant Health, the executive director of Medic, sheriff, CMS, the court system, public health.
And what is your name? Okay, if you'll just hold until county manager finishes, I'll be glad to have you.
CMPD, emergency management. So it's a very broad group of professionals that make up the policy group.
All right, thank you. And that group simply makes a recommendation.
That's correct.
All right, thank you. All right, sir, if you'll come up. Mr. Amin, all right, you have up to 3 minutes.
All right. I got my hands full. All right. All right. First off, I want to say that I'm very grateful for everything you all have done here. I'm from Chicago 3 years ago. This place is just growing like crazy, and then the pandemic, and then everything, right? So this comes from a place of deep concern, specifically for 2 groups. I just want to make sure we cover and help through this next mask mandate, and that is local restaurants and kids. I work in the restaurant industry. I'm starting a restaurant chain. I'm pretty deep into the technology side of it, and any independent restaurant that's survived to this point is on its last leg. Pretty much, if you didn't have a drive-through, you lost all your money if you didn't go out of business. And my concern is all these independent chains or locations are going to go out of business. Their wait staff, their kitchen staff are going to become homeless. These people are near homeless. They don't make a lot of cash. They're undocumented. It's going to be really bad this winter. So if we have to do a mask mandate, I would also suggest some sort of citywide project for local restaurants, a hub of some sort. And then second is the kids. The kids are not getting COVID. They're not dying from COVID. And their teachers can get vaccinated. They can get ivermectin. They can get all sorts of stuff. There's a lot of safe treatments. And I, for one, I believe in the efficacy of the vaccine. It's just the nature of this plant or this virus is that it's going to keep mutating. We're out of a pandemic. We're living with coronavirus, I'm afraid, for the rest of our lives. I was early on COVID. I changed my whole life because in January of 2020, I saw what was happening online, and I was like, this is going to be a big deal. So with that, I'm just saying there's no preventing it anymore. We have to take our immune systems seriously. We have to get better food in the healthcare system, et cetera, and the schools. So I don't think kids should be enforced or under the guidelines of this mask mandate, and I think if we don't want an explosion in homelessness, we have to be careful with restaurants because people are sick and tired of it. They don't want it. They're not going to go out. They're just going to stay at home. Everyone's got a backyard in Charlotte. They're not going to go and support these businesses. It's going to be a nightmare. And just the last note is, if you deliver right now as a restaurant, you don't make any money on that delivery. It's just, it costs too much. People are impressed by Jeff Bezos getting 2-day delivery. It takes, we expect our food in half an hour. It's extremely challenging. So thank you so much. Thank you.
So with that being said, the chair will entertain a motion to authorize the adoption of a countywide Board of Health rule requiring a face covering when indoors in all businesses, establishments, and public places within Mecklenburg County, the city of Charlotte, and the 6 towns, and sitting as a consolidated human service agency, instruct the clerk to the Board of Commissioners to publish a notice of adoption of a proposed Board of Health rule to be effective not less than 10 days after the notice is published. Is there such a motion?
So moved.
Second.
It's been moved and properly seconded. Any discussion? Any discussion? Any discussion? Hearing none?
Are we allowed to talk?
Excuse me, excuse me, excuse me, excuse me, excuse me. Let's not be rude.
I'm asking.
Okay, so the public, this is a board decision. The public is not invited to participate. Thank you. You've been rude all night. Thank you. Thank you. All those in favor of the motion, let you know by show of hands.
You have to do a roll call vote.
I got, okay.
Listen to the public first. You are misinformed, ma'am.
Again,
You are misinformed.
again, I'm going to be nice to you.
You are misinformed.
Officer, would you please remove him?
Let's go. You are misinformed.
Thank you.
And liars.
Have a good night.
And we're sick of you. We're coming for you.
You're communists.
You can take them both.
All of them.
Yep, thank you. No, well, they're going.
Communists that are doing this.
Do you have anything to say to what you heard? Nothing.
Good night.
You've already had your
You
minds
are a
made up
bureaucrat. I
before
know
you even
who you are.
voted, before you even heard the public. This is communism. Communism. And you voted for this for your children.
Thank you. All right, so thank you, Mr. Attorney, for correcting me. This will be a roll call vote. So as I call the roll, you will indicate yes or no. Commissioner Altman.
Aye.
Commissioner Cotham.
Nay.
Commissioner Scarborough.
No.
Commissioner Leek.
Yes.
Commissioner Meyer.
Aye.
Commissioner Powell.
Aye.
Commissioner Rodriguez McDowell.
Aye.
And the chair votes aye. Madam Clerk, that is
1, 2, 3.
6
6 to 2.
to 2. All right. Motion passes. All right. Is there anything else? Oh, that's the only thing we can discuss. All right. At this time, the chair will entertain a motion to adjourn.
So moved.
Been moved. Is there a second?
Second.
All right. Roll call vote. Commissioner Altman.
Aye.
Commissioner Cotham.
Aye.
Commissioner Scarborough.
Aye.
Commissioner Powell.
Aye.
Commissioner Leek.
No.
Commissioner Meyer.
Aye.
Commissioner McDowell.
Aye.
And the chair votes aye. Madam Clerk.
That is 7 to 1 to adjourn.
All right. Meeting stands adjourned.